The Steptoe Group was formed in 2008. Actually, it was purpose-built to deal with some of the issues that we had saw come out of the Iraq and Afghanistan war, particularly the increase in post-traumatic stress disorder, traumatic brain injury, and we felt we had some unique skills to bring to the table, best practices from industry, to help our healthcare providers to better be able to recognize and communicate with patients suffering from these particular maladies. And we felt that by increasing providers' knowledge of post-traumatic stress disorder, traumatic brain injury, but particularly the cultural dynamics of it, that we could definitely help them improve their communication skills with their patients to improve health outcomes. As a service-disabled veteran, we need to make sure that we're providing the highest quality of care to our service members. It's readily apparent that based on the unique dynamics of the Afghanistan, Iraq war, but in particular wars we've had in the past, that mental and behavioral health issues have not been addressed in a manner that really has optimized care for our service members, our veterans, and their families. Well, the Choice Award is very significant. It was presented by the American Alliance for Healthcare Providers. They actually focus on trying to identify the best medical providers and service providers in the country, particularly focused on customer service. Institutions such as Johns Hopkins, the Mayo Clinic, Ohio State Medical Center, UCLA Medical Center have been awardees of this particular Choice Award. So we're very proud to be in good company with those particular organizations that are known to be the best in the world as it relates to providing quality health care and services to the patients that they serve.
Well, let me say a little bit about Iowa State University. It was the nation's first land-grant university in 1858. And of course its mission is to provide support, service and advice to local and national industries and to the community at large. So we're very much engaged with innovative firms in the community, not just doing research for its own sake. And that's very important to us. There's a huge number of collaborations with industries within, of course, the state of Iowa, which is a rather small state, and then more broadly nationally, and also some international collaborations. The subject of deep brain stimulation is one that's been of quite interest for the last 20 years or so. And I'll tell you a little bit about that. What you do in transcranial magnetic stimulation, which is the technology that's of real interest to us, is you apply magnetic fields to the brain, and that enables you to stimulate the neurons inside the brain. Now, why it's been very important is you can actually start to treat brain disorders without having to resort to surgery. So it's a completely non-invasive technique. And that technique has seemed to be useful in a whole range of problems, from disorders such as Parkinson's disease, traumatic brain injury, ischemic stroke, depression, and these kinds of problems that are occurring in the brain.
Well, our focus right now is we're still expanding within the Department of Defense as well as the Veteran Affairs medical community, our training, but we also are now embarking upon a national launch of our training series in cities throughout the United States. Whether it's in the urban setting, whether it's in the rural setting, we really feel it's important that this training get out to all civilian healthcare providers as well as the DoD and the VA medical providers. And because of the nature of our particular training model, we actually have the capability to deploy anywhere in the United States where we train healthcare providers, service providers for military veterans and their families, and making sure that they truly understand the unique dynamics and things that they are experiencing so they can better provide a service to them. One of the reasons that I think it's important for the American people to truly understand the gravity of what's going on is the actual numbers. Here are a few facts. Fact number one, over 60% of our service members, veterans, and their families are being treated in the civilian healthcare system, not within the DoD and the VA system. So we need to make sure that our healthcare providers in the community are aware of their plight and the issues that are being faced, particularly when we look at post-traumatic stress disorder, traumatic brain injury, compassion fatigue, and other mental and behavioral conditions that are impacting these individuals. Next, we always hear that 1% of the population is sacrificing for the other 99%. That in fact is true. But when people come home, the real issue is that over 25% of the population is impacted. When you look at the fact that there are 23 million veterans and their families are involved, and assisting them. And if we just count 2, that's 69 million people. When we look at the fact that we have 3 million on active duty and reserve component, and other ones that support them, with the factor of 2 people caring for them, that's 9 million. So that's over 75 million people, 25% of the US population. 1 in every 4 patients that enter the community healthcare system is impacted by these wars, and healthcare providers need to understand that so they can better provide the service and the healthcare that they so rightfully deserve.